Well, let's get into that. So CET, Constructural Exposure Therapy, how would you explain it in simple, practical terms? And then second to that, what makes it different from the traditional approach to exposure therapy?
In the more practical sort of everyday term, I would sort of look at it as when you want to distance yourself from the thing that is aversive, you're still able to. So when we first started conducting the CT procedures with EEG with the participants here with the study, the first step was the debreathing, tolerating the debreathing. If they moved, if the participant moved their head away, or if they didn't want to continue on with it, that's fine. We waited and till they were ready again, and for the procedure to take place again. At every step, the readiness of the participant to willingly participate and their assent to being touched, to being for the procedure to take place was always the first step to start the procedure. So if they did not want to at that point in time, we did not push it. So the behaviors to escape such an aversive procedure was not, the engagement was reinforced as opposed to toleration of the procedure. And I think that definitely makes it fairly different from the traditional types of exposure therapy, where in this case, each time the participant, we presented the materials, like, okay, this is what is going to happen. Are you ready? Yes, I am ready. Fine, let's get into it. This time the timer is going to be set from 5 minutes to 10 minutes or 5 minutes to 7 minutes, whatever it was. Are you ready? We're going to challenge our personal best here. Let's do this. And once they were able to identify the changes and the differences and they were okay with it, we then proceeded with the next step of the procedure. And that's, I think, fairly different as well, where there is that active participation of the individual undergoing CET too. It's not just a procedure or a script that requires following. It's almost that cross of, I'm going to do this, this is going to be the response is going to result in this, and that's the next step. So it's almost a staggered procedure that gets active involvement occurring as well.
Now, listeners that aren't familiar with exposure therapy might think that's ridiculous, that's crazy, that it wouldn't all be like that. So what happened? What would happen in traditional exposure therapy with say that first step, or with an EEG? How would they approach it? What would be the difference?
The difference there would be it would be me setting the timer for 10 minutes for the participant to tolerate the apparatus on them. If they have to tolerate that apparatus for 10 minutes in order to get access to the reinforcer. If they don't, then I reset the timer and say, no, we need to do this again till you get access, so that you can access X, Y, and Z. So there is a component of, to say it quite loosely, escape extinction also involved, where you have to stay here and tolerate this till I'm done with you tolerating it.
Okay. Yeah. So real compliance focused in that regard.
Yes.
Which, for someone who hasn't been involved with a lot of exposure therapy cases, it's much clearer to me why a lot of families and caregivers are adverse to trying it, because it sounds like it'd be a negative experience, not just for the child, but for the parents and everyone else involved as well.
Definitely. Yeah.
Okay.